Hi, my name is Ana Tonelli. I'm an emergency physician and an internist at Hospital de Clínicas de Porto Alegre in Brazil, and one of the people responsible for teaching point of care ultrasound in our setting. I would like to thank very much Mike for this invitation, and it's an honor to have the opportunity to share our experience. I'm going to talk about the use of ultrasound point of care applied to internal medicine in Brazil. And my intention with this part of presentation is to make you understand what the main challenges in developing point of care ultrasound in this specialty in Brazil are. I also want to show one example of how to start in a traditional teaching hospital and highlight a new application that was a result of disseminating point of care ultrasound in that hospital. Well, Brazil is the biggest country in Latin America with a little bit more than 209 million people living here, with a health system designed to guarantee complete health care to all citizens, which is a mess sometimes. But we also have private insure. Uh, and according to the Ministry of Education, there are around 332 medical schools and more than 6,000 residency programs covering 55 specialties. Specifically in internal medicine, it has a little more than 2,500 new admissions per year. The internal medicine program here in Brazil lasts for 2 to 3 years. Despite the Federal Medical Council gathering input from clinicians on internal medicine competencies, including ultrasound competencies, all efforts to introduce point-of-care ultrasound to internal medicine rely on the interests of individual hospitals, particularly those that have faculty who are competent to teach point-of-care ultrasound. And the main challenges that we list in such a complex country are the scarcity of machines, which still is a problem, the unfamiliarity of preceptors with the compact of ultrasound point of care, and also a resistance on learning how to use that. And the majority of places that invested on having a machine available for clinicians have limited the use of ultrasound to guiding procedures. For example, in this teaching hospital called GHC, Grupo Hospitalar Conceição, the internal medicine point of care ultrasound group has followed the use of point of care from March 2015 to May 2017, and they had 1,069 procedures done by ultrasound, being the majority of it central lines accesses, but also other procedures like lumbar puncture, paracentesis, and thoracentesis. In September 2014, a teaching hospital in the south of Brazil, which this year will become the biggest hospital in Latin America, decided to develop a program to teach physicians, internal medicine residents, and emergency residents to train competencies in point of care ultrasound. The course is sponsored by the government and it is called PICAP. This program has 4-week courses. It's full-time and it's dedicated to use of point-of-care ultrasound using simulations, but more importantly, it occurs in real scenarios like the emergency room and clinical wards. The contents covered by a 4-week course are lung, focus echo, DVT, aorta, IVC, FAST, gallbladder, urinary, ocular, and soft tissue. Jose, who will be the next panelist, will present some cases that will give you an idea of the applications of these exams. The course also covers procedures that are training during the 4 weeks, like peripheral vein, central lines, thoracentesis, lumbar puncture, and paracentesis. The residents have to develop a portfolio with a minimum of 150 exams, which are reviewed by a second physician that gives of each week. And the strategies and methodologies used during the course are traditional lectures, flipped classroom using e-learning, supervised quality assurance of the images, journal club, free hands-on with image uploads and to the portfolio and supervised hands-on. The evaluation is done with an OSCE that is performed in a real scenario at the end of the 3rd week and repeated at the end of the 4th week, followed by individual and direct feedback. After almost 3 years of this program, we decided to look at some indicators, and its results were presented at the 6th Brazilian Congress of Emergency Medicine in 2018. Those efforts got us an award, the best oral presentation in that Congress. And from September 2014 to July 2017, the program had 55 residents, 3 preceptors, and 1 professor that completed the course. 82% had completed the portfolio. Almost 98% had performed all exams proposed by the content of the program, and more than 73% had performed all the procedures. After the course, the main use of ultrasound was to make decisions about respiratory failure and shock, with the main exams being lung, echo, and IVC, meaning a change of focus. If you remember that at the beginning of this presentation, I told you that to use ultrasound was focused on guiding procedures. After the course, most of the residents applied point-of-care ultrasound at least once per week or almost every day. One of the residents that completed the course decided to do her final paper using point-of-care ultrasound in a different way. And it is well known that elderly people have to be comprehensively assessed in order to identify risk factors for functional decline and rehospitalization. One part of that evaluation comprehends muscle function, and the 2 tests accepted to do that are gait speed and time it up and go test. The problem is that those 2 tests are restricted to individuals with preserved walking ability, which is not common in hospital patients. With that in mind, the resident decided to revise the literature and develop a new use of ultrasound to try to predict rehospitalization or death and functional decline. First, she validated the method, and then she followed a cohort of 100 patients with more than 65 years old. She measured the dominant thigh thickness and the contractile part of the thigh, composed by rectus femoris and the vasto-intermedius muscle. With this measure, she developed a contractile index of the thigh, and 3 months after discharge of the patient, she performed a follow-up by using a phone call. The results have shown that this is a valid method to assess the relative risk of rehospitalization and death and functional decline. I decided to show you this example just to give an idea of how a simple thing can help with the clinical practice. So this is what I have to share with you. So thank you very much. And for now, I think Jose will do the presentation.
Thank you very much, Ana. That was a great lecture, and I really appreciate you taking the time to present to us. I really like that study that the resident did. It's amazing what you can do with ultrasound.